Hey team, welcome to the COVID-19 job site mobilization training. Want to thank you for your interest in returning back to work. I understand most of you have been eager to get back out there. Some have had some questions and a little uncertain about returning. Hopefully we can clear that up during this training, make you feel a little bit more comfortable. I do want to start off by making it clear that working under these new conditions is not mandatory. And if you're out there and have any concerns about your health or the site conditions, please notify your supervisor immediately. A few things we're going to touch on today is explaining what COVID-19 is, the symptoms, and prevention methods. Also, we're going to go over our action plan so we're all on the same page, going over wellness checks, PPE, what we're going to do within 6 foot, um, how we're going to clean and disinfect, what chemicals we're using and how to use them appropriately, and some job site changes that you'll be seeing out there. COVID-19 is a coronavirus disease that was discovered at the end of 2019. Most people infected with COVID-19 will experience mild to moderate respiratory illness and recover without requiring special treatment. However, older people and those with underlying medical problems are more likely to develop serious illness. According to the CDC, symptoms may appear 2 to 14 days after initial exposure. Some of these symptoms include a cough, shortness of breath, or difficulty breathing, or a combination of symptoms such as a fever, chills, repeated shaking, muscle pain, sore throat, headache, and loss of taste or smell. It spreads between people who are in close contact of one another, typically within that 6 foot radius. Also spread through respiratory droplets produced when the infected person coughs or sneezes. Those droplets can land on the mouth or nose of someone nearby. It also may be possible to transmit by touching a surface or object that has the COVID-19 virus and then touching mouth, nose, or eyes. So once you get out to your job site, you're going to see things are slightly different out there. Each GC will have a different plan implemented, so make sure you get with your foreman and read through their plan to date. First off, starting off with a wellness check. Most GCs are going to be running one of these. Some have a drive-through lane. Well, they'll be doing this. Most have a single line formation where you have that 6 foot distance. They'll be doing a non-invasive temperature check, making sure you're under that 100.4 mark, along with questionnaire of if you've been in contact with someone that has had COVID-19, those kind of questions. Real short and simple before you can even be allowed on site. You'll also see an increase in hand washing stations, restrooms spaced out like in this picture here. See a lot of signage out there, dedicated cleaners on most job site where they're going around wiping down common surfaces. Break areas are going to look a little different. There may not even be food trucks allowed on site, and limited entry. You may not be able to leave and come back on site. But like I said, each one is going to be different, so make sure you follow the plan that is implemented on that job site. Let's get into SVM's COVID-19 action plan. As you can see on the right, that binder there, that's what's going to be on your job sites when you're out there. On the front, it has the QR code for our wellness check and then a spot for our COVID-19 supervisor. So who's going to be in charge of making sure we're implementing our plan. Within the binder, we're going to have our full action plan so you can reference. It's also been sent to you if you have an email set up with us. Everything's in there for you to review. Some of our administrative controls that we've implemented are assigning a COVID-19 supervisor. Their responsibility is going to be communicating with the GC, making sure we're following their plan as well as our plan, and then refilling any supplies needed. We've implemented a wellness check that will need to be completed daily. It's no handshaking policy. If you're sick, stay home. We're trying to minimize any face-to-face meetings, limiting shared workspaces, and then also limiting visitors. SVM will be providing each employee with their own bottle of hand sanitizer. There's also the mandatory use of face coverings that SVM will provide. Safe work practices on the job site. Starting off with scissor lift, we're going to stick to one person on the scissor lift at a time, preferably assign someone to that lift for the entirety of the day. If you do need to share, it needs to be cleaned and disinfected before the next person can use it. We're also going to eliminate the sharing of computers, phones, tools, and other equipment. Same thing with those. If you need to use someone else's stuff, it needs to be cleaned and disinfected before use. We also recommend that you pack your own lunch just in case there is no options on your job site. We're going to continue to supply you with water bottles, so there's no shared water coolers. Also, at lunch areas, make sure you're maintaining that social distancing of 6 foot. And we recommend going directly from home to work and from work to home with as little contact with the general public as possible. So regarding personal hygiene, first off, if you're sick, stay home. Make sure you're washing your hands for a minimum of 20 seconds, fronts, backs, in between, get your fingernails, all those. If soap and water is not available, make sure you use some hand sanitizer. Like I said, we will be providing each individual with their own hand sanitizer bottle. So make sure you carry that with you if you can. If not, make sure you have a common area that has some there so you can get to it. Wash your hands at the beginning and end of each shift. Avoid touching your eyes, nose, and mouth. Cover your cough. So along with your site wellness checks that the GC performs, SVM will also be performing their own wellness checks. Just so you know, we have a zero tolerance policy. If any worker shows up having any of the symptoms of COVID-19 or a fever over 100.4 will not be allowed to enter the site and will be asked to go home. We got that binder there. So like I said, every job is going to have that on site. There is a QR code there. So if you have your own personal phone and would like to use it, all you have to do is scan that QR code and it will bring up this questionnaire that you see on the right. It's just a few simple questions. It has the job number on there, so make sure you get the correct job number. And then those questions of have you been in close contact with someone that has been confirmed with COVID-19? Do you have any symptoms? And then a few other follow-up questions. So make sure you fill that out, submit it, and then you'll be allowed to enter the job. Social distancing is a simple yet very effective way to prevent potential infection by staying at least 6 feet away from one another. We're going to eliminate any handshakes or close contact, avoid anyone that is sick, coughing, or sneezing, and no carpooling unless you live in the same household. Some new PPE you'll be seeing on site are the face coverings that are mandatory by the county, nitrile gloves, and implementation of face shields. We are not allowed to use any medical grade PPE, including N95 respirators, unless it is specific to like a silica dust or asbestos. As far as the face coverings, we will be providing each employee with 2 to 3 face coverings. There are a couple different styles and sizes, so make sure you get one that fits properly. It needs to fit snug and comfortably against the side of your face. We have had some issues with glasses fogging up, so try different versions if you're having those problems. Make sure it does cover your nose as well as your mouth. I see a lot of people wearing these with just covering their mouth with their nose out. That is ineffective. So make sure it's comfortable. You do need to wear these all day. If we briefly have to work within 6 feet of one another, we'll continue with just the face coverings and our normal cut resistant gloves. And when I say briefly, I mean if we need to move a pallet quickly or if we're just passing by one another. Anything that is a prolonged period of time, say we're hanging a unit or if we're moving a lot of material together, we would have to don on additional PPE such as our face shield and nitrile glove. Cleaning and disinfecting the job site. All common SVM areas will need to be cleaned and disinfected 2 to 3 times a day. Make sure you're using paper towels. Don't use cloth towels. Make sure you can throw them away and dispose of them properly. Soap and water or hand sanitizer should be provided in common areas. And if surface areas are dirty, they should be cleaned using like soap and water before you disinfect it. A couple common areas are like if we have a break or lunchroom, any mobile equipment, shared tools, gang boxes, carts, and job trailers. Please note that the disinfectant that we are sending out to job site is an ammonia-based disinfectant. Basically what that means is do not mix anything with this chemical. Anything like bleach or alcohol can produce a gas that is harmful to you. Also note that it is a corrosive. As I mentioned earlier, we will be providing each individual with their own hand sanitizer bottle. If you happen to run low, just send it back and we will get you a new bottle. If an employee is exhibiting COVID-19 related symptoms, they will be instructed to stay at home in self-quarantine until 72 hours after the resolution of their fever or respiratory symptoms, including cough. That is without the use of fever-lowering medications or cough suppressants. If If an employee has a confirmed case of COVID-19, they may return to work after the 72 hours post-recovery, or at least 10 days have passed since symptoms first appeared. We also added some extra resources and materials within our action plan. So please make sure you review that in detail so you're prepared for when you return to the job site. If you have any questions, feel free to reach out to me at safety@svminc.com or contact me personally at 408-568-7896. Be safe out there.